Good morning. My name is Nali Clemens. I'm the president of JMACA, the Federation of 34 Agencies, Human Services Agency in Orange County. We have a great partner in Assemblywoman Aileen Gunther, who leads New York State in the Assembly as a chair of the Mental Hygiene Committee. And today we're here to talk about mental health. Let's welcome an advocate and a friend, Aileen Gunther.
Thank you, Nali. First of all, thank you for hosting me today on this important issue. And first of all, I'm going to tell you who I'm joined by today. I have Ann Miller and Ray Rodriguez from Independent Living, Darcy Miller, we all know from the Commissioner of Mental Health and Social Services in Orange County, Tom Bolzan from Orange County Department of Mental Health, Amy Anderson Winchell from Access Support for Living, Nadia Allen from the Mental Health Association in Orange County, Nali Clemens from RSS, Rehabilitation Support Services, Dean Scher from Catholic Charities, also from Catholic Charities, John Lent, Steve McLaughlin from Action Towards Independence, Chris Fortune, ARC of Orange, Jeff Spitz from Restorative Management, Anthony Acamando from Hudson Valley Community Services, Elise Gold, Jewish Family Services of Orange County, Bill Samus from Crystal Run Village, Peggy Spagnolia from Mental Health Association in Orange County, and NAMI. Also from NAMI is Danu Sanasi, I hope I'm pronouncing that correctly, Lordy Schneider from Sullivan County, Friends and Advocates for Mental Health, Kellyanne Costel from Safe Homes of Orange County, Peg Kimple and Kelly Ocasio, Beth Post from Middletown Carers Coalition, Faith Levesque from Highland Rehabilitation and Nursing Center, Arthur Lasco and Tara Sobel from Touro College, Christina Hamilton, Montefiore, thank you for coming all that distance, Melissa Statz from Westchester Medical Center, and Joel Middleman from Refuah Health Center. So good morning, and I'm glad to be here. I'm also joined today by who has become not a dear friend, but an ally and trusted advisor for the Mental Health Committee, which I chair. Glenn Liebman has worked in mental health field for decades. He is a tireless advocate for people and their families, and I am so grateful that he made the trip down from Albany today. We're here today to urge our governor, Governor Cuomo, to sign legislation creating a tax checkoff on personal income taxes. This would allow New Yorkers to make a gift to fund the fight against mental health stigma. Currently, New Yorkers can make gifts to any of 8 separate programs, many of them for health conditions such as breast and prostate cancer. But also there's fish and wildlife management, as well as the Lake Placid Olympic Training Center. This legislation has been a priority for the Mental Health Association in New York State for years. Passing it this year was a team effort. It took persistence, perseverance, and a network of outstanding advocates. Here's why it's so important to us. 1 in 5 adults in America have mental illness, yet only 40% received care in the last year. 20% of all children ages 13 to 18 live with a mental health condition. Half of all lifetime cases of mental illness begin by the age of 14 and 75% by the age of 24. And yet, the average delay between onset of symptoms and intervention is between 8 and 10 years. 8 and 10 years. Half of these children will drop out of high school. Mental illness is an economic crisis. In America alone, serious mental illness cost $193.2 billion in lost earnings every year. Almost every child who drops out of high school because of mental illness have been robbed of their chance for a healthy and financially independent life. But most importantly, mental illness is a public crisis. There is not a person whose life has not been directly or indirectly impacted by by it. And you know, every one of us here knows somebody that we love that has had a crisis. It is a recoverable illness, but not only with appropriate treatment. Study after study tells us that one of the largest barriers to treatment is stigma. One study revealed that people believed individuals with mental health problems were dangerous. It also showed that their belief that some mental health problems, like eating disorders, are self-inflicted. These perceptions, this misinformation, keep mental illness in the dark. It's talked about in whispers, joked about, and all too commonly misunderstood. As a society, we're too quick to define people with mental health problems as their illness. Somebody is a schizophrenic. They are depressed. They are bipolar. Now imagine if we did the same thing for physical conditions. Somebody is cancer. They are high blood pressure. They are Alzheimer's. The goal of this legislation is to shine some light in the dark places and begin to talk about and treat mental illness honestly and openly like any other illness, because it is like any other illness. And this won't happen without many, many calls by not only the advocates in this room, but you come in contact with people every day that might have a family member, a friend, a husband, or a wife. We need you to call Governor Cuomo and say, sign this bill and sign it now. We've worked long and hard over the years. Ben Liebman has been phenomenal. People wrote letters. I heard from family members, and the time is now, and I need all of your help. And you have Montefiore. It's a big, big old hospital, and you go back and tell them that we need their help.
We are so grateful to have a passionate advocate like Assemblywoman Aileen Gunther to prioritize mental health. And now another advocate, the Chief Executive Officer and a person behind this effort, Glenn Liebman.
Thank you, Nolly. Appreciate it. Good morning, everybody. It's what Aileen just said is, I don't even have to say anything. She, as we know, Assemblywoman Gunther is a great advocate in the community, great advocate for mental health, and a great friend. She's had, I think, the record this year in the Assembly for 32 House bills passed, which is incredible. And if you know her, you know what a priority this is for her. She actually will go into offices, and I don't know any other Assembly member who does, goes into the offices of the Senate and said, you got to pass this bill. You got to pass this bill. This is the kind of passion that we have and the great leadership we have through Assemblywoman Gunther. We're very lucky to have her. So in terms of, and again, Aileen said it very well. It's a very simple concept, a tax checkoff. As she said, there are 8 of them in New York State right now. You look at the tax forms and you'll see, and even when you do it sign electronically, you'll see about 8 different categories. We have been pushing for several years to have mental health public awareness as part of it. And why? Because we know that 1 in 5 people, as Assemblywoman Gunther said, 1 in 5 people in this country are impacted directly by mental health related issues in the course of a year. If you add family members like myself, close friends, we're all impacted. There's nobody I know of who's either not directly or indirectly impacted by mental health related issues. And yet, for several reasons, led by stigma, people do not seek services. As Assemblywoman Gunther said, 10-year gap. Can you imagine any other illness where there's a 10-year gap between onset and actually seeking services? And when you ask, and when you're surveyed about that, when people are surveyed about that, what do they say the number one reason is? Stigma. It's all about stigma in one word. It's discrimination, it's stigma, because the reality is that people recover and move forward in their lives. if they receive treatment early, if there's early intervention in place, if there's preventative services in place, people will get better sooner. We don't have to worry about all the psychiatric disability, and we don't have to fight the stigma constantly that we fight every day in terms of when we're advocating for resources, when we're advocating for funding. It's always about, well, you know, people with mental illness are violent, they're crazy, they do wild things, and that impacts public policy, that impacts everything we do, when in reality we know none of that is true. In reality, we know when we hear about violence and people with mental illness committing acts of violence, we know that people with mental illness are 12 times more likely to be victims of violence than perpetrators of violence. And we also know that 2 out of 3 adults in this country who do have the need for mental health services never seek them. We have to do something about that. And the tax checkoff is a significant step forward in this fight. It doesn't end all, it's not a be-all saying, oh, we have a checkoff, this is great, but it is a significant step forward. And that's why we're so praiseworthy of Assemblywoman Gunther making this such a priority for her. We have to also thank Senator Carlucci, who passed in the Senate, and Senator Ord, who's the mental hygiene chair in the Senate as well, who were pushing it equally. But now it's waiting for the governor. We hope that the governor, again, this is landmark legislation. We really continue to advocate and push. This has been such a significant effort statewide. I can't tell you how many thousands of people have made calls, have sent letters, and have sent emails, because this hits a bone with people. This really bothers people. People understand the stigma, and I think that is really significant. And that's why we're urging Governor Cuomo, when it comes to his desk, to sign this bill into law. And I thank you all very much for being here today. Thank you.
A lot has been said in terms of the effort, but we have someone here in Orange County, a visionary leader, who is the Commissioner of the Department of Social Services, who has the idea that everyone in Orange County should be welcome everywhere that they access service. Let's welcome Commissioner Darcy Miller.
Good morning. It warms my heart to have Assemblywoman Aileen Gunther and Glenn Lieberman here today talking about an anti-stigma campaign, a checkoff on our tax forms. Just imagine that we've come to this place where this is possible, where we will be sending out to everybody just the language itself coming into their home acknowledges it's real. It is a public crisis that we do need to be addressing. When we talk about 1 in 5 adults and the percentage of them being treated, let's look at our children. 1 in 5 of our children have mental illness, and 1 in 10 of them have serious mental illness, and only 21% of them are in appropriate treatment. Thank you. We need to be working together. We are all advocates here in this room, but our family of advocates has expanded greatly. And I have to say, from my perspective, and I'm sure many of you share, the horrible tragedies that have happened across this country that are connected to people with mental illness, that add to the stigma, then the myth that people with mental illness are violent. When you just heard Glenn speak about what the true statistics are, but what those horrible tragedies have done is they've opened up conversation. They have brought people to the table willingly and happily. We have law enforcement coming to the table with us today doing CIT training, critical intervention training. We have schools that are asking us if we'll open clinic satellites. In Orange County alone, we have our 5th school coming on board. I'm looking at Tom Bowles and our deputy commissioner over there. We're so excited to have the clinic satellites in Newburgh in 2 school locations, in Warwick, which was our first, in Pine Bush, and now moving into Port Jervis. We've had this in the past, but it wasn't as successful because our communities weren't ready to accept that mental illness is real, and when we see it, we need to treat it. Because when our young children are identified as having those symptoms, the earlier the intervention and the more appropriate the intervention, the better the outcomes. We don't want to see 50% of children with mental illness not graduating from high school. We don't want to see them becoming permanent, dependent on a system. We want our communities to support their wellness and their recovery. We know what happens with this stigma. People isolate, they separate, they become alone, and their symptoms get greater. We also know the challenges of being successful on treatment when it comes to taking medication that has side effects that will change their lives. But we need to have the education and support so they understand that the side effects of those medication are not as important as the benefits of the medication, and how do we sort that out? We need to work together with people to make that happen. To be able to be in a place where our governor has an opportunity to make a difference in so many lives and to expand this anti-stigma campaign, I feel fortunate to be part of this community for decades now, too. It goes fast. But thank you, Assemblywoman Gunther, for this opportunity, and we are 100% behind you and supporting you in having this bill passed. Thank you.
So now we're going to take some time for Assemblywoman and Glenn to answer questions regarding the importance of this bill.
Well, you can answer the question. Awesome.
Anyone?
Anybody?
Why did this take so long? When you look at this list of checkoffs, Fish and Wildlife's important, Olympic Committee's important, neither one of them is nearly as important.
I'll have to ask you back, why did it take so long for a population that is in such crisis, and it shouldn't have taken that long, and that's why it's important that we gather here today and encourage the governor to sign this piece of legislation as soon as possible.
Can I just add that,
Go.
thanks.
Glenn's
It's
been
true.
doing it for 20 years. He's got a better explanation.
Whoa. I think that there are a lot of reasons why, and a lot of it is a stigma. It's sort of that catch-22. There is the stigma that goes on. People don't want to talk about it, and it's unfortunate because, and we've said this for years, can you imagine the kind of constituency we would be if people talked more openly about this? You take that 1 in 5 number, you take the family members, the close friends, we're all impacted, and if we all spoke out about the issues that face people with mental illness, and whether from the children's perspective, whether from the adult perspective, it's incredible the power and authority, the abilities we would have to be able to really shape public policy. And we're really hoping that this is the first in a series of changes that are going to impact dramatically mental health, the public mental health system, and just the system as a whole in terms of mental health.
I just one thing. I just want to talk about the fear for a minute, because part of the stigma is the fear of our community around mental illness, because we haven't linked mental illness with recovery to the extent that we need to. And we really need to put that hope out there for those who are struggling, whose loved ones are struggling with mental illness. They need to understand that there is hope, and treatment leads to recovery. It will help us to move this issue forward.
Any other questions?
Are these statistics that you see growing year by year, or is it kind of even down a straight line, or what's it looking like currently?
I think it's growing.
I would say that the statistics have remained pretty static, but it's the more people. We do have more people coming forward with treatment and people being identified as having the illness. But research has kept pretty consistent for quite some time with the 1 in 4 and 1 in 5 numbers.
Darcy, I have a question. As I have realized, I'm a family member. The more I speak up to the community, I feel like it encourages the other people to open up themselves, and that's what I have realized in my life. And I feel like it's really important. The family members should open up and speak about what they are going through, so that the other people can able to share their experiences.
Can I just add to that? I think that's a great comment, and I'm a family member as well. And I've been a mental health advocate before my family members started, having their own issues, and you see it from so many different angles. And as a family member, it's incredible. You feel. You see what's going on in terms of the system in a whole different way, and the frustration and the stigma you feel directly. We've always talked about it impactfully and what it means, but when you're seeing it directly impact your family member, there is nothing like that. And that's why we have to continue to speak out, because we can't let this discrimination and stigma continue.